Have you ever injured yourself in a sporting competition? Have you ever felt a sudden snap in your leg and was unsure what had just happened? You could not move due to the paralyzing fear that it might get worse. Thoughts are rushing through your head. Will I ever be able to play again? Will I be able to compete in the sport that I love? Just as anxiety starts to set in, your guardian angel descends. She reassures you that everything will be okay. Her gentle hands carefully palpate the injured area. You feel a little bit better. You are not alone anymore. With a calm voice, she tells you everything will be okay and helps you up. This is what I strive to be, the guardian athletic trainer that will reassure an athlete in their moment of uncertainty. Athletic training encompasses the examination, prevention, diagnosis, and rehabilitation of acute, emergent, or chronic injuries and medical conditions. They are the first medical professional on the scene after an injury to help prevent further endangerment of surrounding muscle structure, and they are even capable of suppressing life-threatening injuries until an EMT arrives on scene. They collaborate with doctors to provide emergency and follow-up treatment programs for injured athletes. They are a vital communication link between patients, physicians, coaches, and the patient's family to help determine when the athlete is ready to return to competition and practice. In the day-to-day life of an athletic trainer, they have to protect and prevent injuries by applying tape, braces, and bandages. They need to be able to evaluate injuries and provide first aid where needed. When they are not physically working with a patient, they have to write rehabilitation programs for an injured players and further develop their injury prevention program. Some of the less hands-on work requires them to write reports such as a SOAP note, subject eval, object eval, assessment, and plan, and administrative duties where they have to contact coaches and plan their attendance schedule for each sport. You can find an athletic trainer in a variety of locations. They can cooperate with physicians and physical therapists, while they are an integral member of the healthcare team at K-12 schools, colleges, and universities, fitness centers, hospitals, and professional sports teams. Athletic trainers has become a long way over the years. It started in 1881 in the United States of America when Harvard University employed James Robinson to work on the conditioning of their football team. At first, they had no real techniques or training and mainly provided rubdowns. Post-World War II, they began playing a larger role as there was a larger demand for athletic training in collegiate athletics. In the 1920s, the Kramer family started a chemical company that produces athletic training equipment and began on the publication of First Aider. The attempt at the National Athletic Training Association, NATA, was in the 1930s. In the 1950s, it was officially formed in Kansas City, Missouri, that established the professional standards for athletic trainers. Today, they have more than 54,000 members worldwide, and the NATA convention sees more than 11,000 attendees, with an average of 325 exhibiting companies. In 1959, the first collegiate athletic training curriculum was approved, and in 1969, the first certification process was introduced. The Board of Certification was introduced in the 1980s, and in the 1990s, the American Medical Association officially recognized athletic training as an allied health profession. In 1997, NATA Council was founded. They determine competencies that should be taught in accredited athletic training programs, such as prevention and health promotion, acute care of injuries and illness, and evidence-based practice. To become an athletic trainer, you will need at least a bachelor's degree, but that might not be enough as the NATA reports that at least 70% of athletic trainers have a master's degree. Athletic trainers' curriculum follows a medical-based education model. they will have to take courses such as anatomy, nutrition, biology, and kinesiology. The typical pathway after high school to become an athletic trainer is a bachelor's degree, graduation from a CAATE accredited athletic training education program, and passing the Board of Certification's certification exam. It does not stop there, as you will have to continue education as long as you are practicing, and you'll have to complete courses to stay certified. Athletic trainers must work year-round and sometimes with multiple sports. They average between 60 and 70 hours a week, depending on the needs of the specific school, university, and the demand of athletic trainers. The more athletic trainers there are, the less time you will have to work. At a college where the number of students are between 1,500 and 2,000, with 10 athletic trainers, they will only work around 50 to 60 hours. The average salary of an athletic trainer is $47,000 annually, but it depends on the location, qualifications, and experience they have. The field is cooperatively small to others, which makes it highly competitive, especially for positions on college and professional sports teams. The Bureau of Labor Statistics projects that the employment rate will increase by 23% from 2016 to 2026 due to an increased awareness of the effect of sports-related injuries and that it is possible to prevent and reduce the time an athlete has to spend recovering due to an injury. Secondly, the usually sedentary older population has become more active, providing an increased need for athletic trainers. Athletic trainers are highly qualified, multi-skilled healthcare professionals who collaborate with physicians to provide preventative services, emergency care, and clinical diagnosis. They work under the direction of a physician as prescribed by state leisure statute.